Hey, good morning, guys.
Morning.
Looks like we've got more people joining, but we'll just take a couple more minutes before we get started. Okay, we should probably get started. It's great to see your shining faces. And for those of you who aren't on camera, which is fine, your names. I love to know that you're here. That's great. And yeah, we'll just go ahead and get started knowing that we'll probably have others joining us in the next few minutes. All right, so here is our agenda for today. We'll start with our usual introductions so that we make sure we know who's on the call. We talk about some regular announcements and some maybe not so regular announcements, and we'll give you any updates that are going on with the medical home portal. We always reserve some time for you to bring up any cases that you're working on and would like some help with. or if you have resources that you'd like to share with us, any updates, anything going on with quality improvement, motivational interviewing, et cetera, et cetera. So we hope you'll take full advantage of that time. We are excited today to have Judy Jaworski from the Salt Lake City School District talking with us about schools, health plans, children with medical needs, COVID-19, all of the above. And we know that this is a very unusual time, to say the least. I'm looking over at my agenda times and realize I didn't update that correctly. We anticipate that Judy's presentation and the questions and answers in that will take us right up to close to 10. And then we'll wrap it up and call it a meeting. Okay, so let's go ahead and get started with introductions. And the way this seems to work best is if I look at the participants and just go down the list. So we'll try that and I'll start. My name is Mindy Tueller and I manage the Medical Home Portal and I manage the Utah Children's Care Coordination Network. And I think most of you know me, but we always love seeing new names and faces on this list. By the way, this meeting is open to anyone. So there's no eligibility or restrictions or anything like that. So if you know somebody else who'd like to participate, you're certainly welcome to have them join. And we love to have everyone who's interested be a part of this. So let's see, I'll just go down the list. Michelle.
Hi, yeah, I'm Michelle Redfield. I'm the administrative assistant for the Medical Home Portal, UCCCN, and it seems like the list keeps growing as we get more programs that we're involved with. So good morning.
Great. Good morning. All right. And I do see some people putting their names in the chat and their information, and that's great. Just want to let you know that the chat is a real silver lining out of Zoom, out of the pandemic. The chat means people can participate in ways that they wouldn't have chosen to or been able to before. So we love that. Please use the chat. And I'll just go ahead and quickly say that Nikki is a care coordinator for Busy Bee Pediatrics in Bountiful, and we're so happy Nikki can join us. And then Kylie Richardson is with Holiday Pediatrics, and she is a care manager there. So welcome, Nikki. Welcome, Kylie. And let's see, looks like Erica Wall is also using the chat. She is a care coordinator with Tri-County Health Department. And she's got some other, well, children with special health care needs, care coordinator, and a TCM manager. So I'm not quite sure what the TCM part is, but Erica, welcome, and we're happy that you're here. So very good. Okay, Alicia, I don't know how to say it. Alicia, yeah, Mather, Memorial Pediatrics Care. Oh, and that is terrific because we used to know your predecessor at Memorial Pediatrics, and we're so happy that you can be with us as well. So that's terrific, and I apologize for butchering your name. All right, very good. And so Athena, looks like you're up.
Great. My name is Athena Parker, and I am also with the Medical Home Portal. I help our partnerships with other states and then also maintain the Utah Service Directory.
Terrific. Thanks, Athena. And Dora.
Good morning. My name's Dora. I'm the Professional Relations Coordinator for Shriners Children's. We switched the name now that
Okay.
so I think
you're going to have to tell us more about that.
Yes.
Okay.
Well, I think we announced it a couple months ago, but I can go over it in a little bit.
Great, and I'll remember it this time.
You're okay.
Thanks.
It'll take me a while. Thank you.
All right. Okay, Eric Christensen.
Good morning, Eric Christensen. I am the program manager for the Integrated Services Program, Utah Department of Health, Bureau of Children with Special Health Care Needs.
Welcome as always, Eric. And let's see, I have a couple of Ginas. So I'll start with Gina Polomeni.
Hi, Gina Polomeni. I guess I'll say alumni of Children with Special Health Care Needs Medical Home and UCCCN. That's all.
Emeritus. We're so happy you're here, Gina. All right, other Gina. This is Gina without a last name, so I'm not 100% sure who it is. And if it's easier for you to put your information in the chat, that's also just fine. All right, that's okay. We'll come back to other Gina, and we'll go on to Gwen Anderson.
Good morning. My name is Gwen. I cover Carbon, Emory, and Grand counties for Eric's team with the Integrated Services Program, and I love being part of this, so thank you.
Gwen, we're so happy you're here. And Ileana.
Hi, this is Ileana from Southwest Children's Clinic, and I'm the manager over here.
Is it just you today, Ileana?
I'm waiting for Janet, but she's not here yet.
Okay, so we think Janet will join you too. Great. Good morning. All right, next I see Jade.
Hi, I'm Jade with University Health Plans and Helping You Medicaid.
Glad you're here, Jade, for
Thanks.
whatever time we get
Right,
you.
right, till 8:55.
Okay. And Jill Connor.
Good morning, Jill Connor. I'm with Shriners Children's in Salt Lake City. I'm the Director of Business Development.
Wonderful, glad you're here. All right, and Judy, you're up next, so I'll let you introduce yourself briefly here.
Okay, my name is Judy Jaworski, and I'm the lead nurse for the Salt Lake City School District. I'm happy to be invited to attend today.
Yeah, we're so happy you're here too. Really looking forward to that.
Yeah.
All right. Kayla Younger.
Hi, I'm Kayla Younger, and I'm a care manager at Bountiful Pediatrics.
Excellent. Welcome. All right. And Laurel.
I'm Laurel Bishop, and I'm a UR-Land parent trainee.
We're very happy you're with us this morning, Laurel. And Lexi Stanley.
Good morning. I am Lexi Stanley, and I'm the new transition specialist with CSHCN. I'm on Eric's team, and I'm really liking what I'm doing so far.
Oh, that's great. Well, we're happy you're here. That's an important role. Okay, up next, I see someone with just the name Linda.
It might be me, Linda Stevenson. I'm with Integrated Services in Central Utah, care coordinator.
We are so pleased you're here. That's great. Okay, and then I see Nikki, and we also already got Nikki's info in the chat. So next it's Walt.
Good morning. This is Walt Torres. I'm with also with Integrated Services Program, which is part of the State Health Department. And I'm a care coordinator located in Salt Lake.
Glad you're here. And Tina. Tina might not be able to unmute. Tina Purcell.
No, I can.
Okay.
Sorry. I had a kiddo that needed my help for a few minutes. And so I'm Tina. I am with Utah Family Voices at the Utah Parent Center. I am also an author with the Medical Home Portal, and I'm first and foremost always a mom. I work at home with my kiddo, but I'm always here at home to help with things if you need me at Utah Family Voices.
Great. We're so happy you were able to join us today. And I do see that one other Gina has joined us. Well, things are changing. Anyway, that's okay. Oh, Sherilyn, there's somebody new. Sherilyn, can I put you on the spot and ask for you to introduce yourself? And you can use the chat if that's easier. And that's okay too. So I think we have a couple of people who weren't able to introduce themselves, and that's just fine. So no problem. We'll go ahead and move on, and we're just happy that you're all here. I got to tell you, my touchpad seems to have a mind of its own today, so I keep advancing the slides accidentally. Let me go back and see if I missed anything on the previous slide. Yeah, I'm going the wrong way. There we go. Okay. So as we mentioned pretty much every meeting, if you're able to actually join us on a laptop, or a desktop, we feel like that's the best experience, but we'll take you any way we can get you. And we'll try and end promptly at 10 to respect your time. Okay, so I've got the name wrong and my apologies, but we're going to go ahead and start out with announcements from Shriners, and we'll let Dora talk for a minute about their car seat clinic.
Yes, thank you. No, it's going to take me a little bit to get used to the name. That's no problem at all. Since we are, so I'll just go over the special needs car seat clinic. So that is especially for children who have if they need any support for if they're sitting, any trunk support, or they have low muscle tone, it's a good idea for them to be evaluated just because they don't have the support of the muscles to, if they happen to be in any kind of car accident, there's special needs car seats that they will evaluate and make sure that the child is safe. And the thing that's unique about this clinic is the nurse practitioner will be in the clinic to evaluate with our therapists who are they are trained to make sure that they're certified with special needs car seat clinic seats as well. So they all work together to evaluate. They come into the clinic and they will make sure that they take off in the seat that they need. And then the therapist will write the medical note, and they will make sure that if it is covered by insurance, they'll go ahead and cover it. If it does not, then it's a donation to the family. We just want to make sure, and the thing that's unique is that they get to leave the clinic with the seat that they need. And we've noticed in our clinic that out of 10 kids that come in, only one of them is done correctly. And just families don't know that there's chairs for their children out there. These seats usually start at $500. They'll go up to $7,000. So for them to come in, it's really nice for them to know that no matter what, that they will be taken care of. And they'll assess the car seat and make sure that they're safe in whatever they come in.
That's fantastic.
Thank you, Mindy. Oh, and they don't have to be a patient of Shriners. That number that's on this card, because they are seen by a medical provider within the clinic, they don't need to come in for anything else. It's just directly to the car seat clinic.
Okay. That is a tremendous service. So thank you for letting us know about it and reminding us about that. And yeah, I hope you guys can take advantage of this kind of thing.
Yeah, we're just there as a resource if anybody has questions, and if there's any physical therapist that wants to come into the appointment with them, they can always come in. We're there to work as a team with everyone in the community. Thank you, Mindy.
Thank you, Dora. All right, our next announcement is about well, it's a little bit complicated, so I'll start with saying that the Medical Home Portal staff is now taking over the University of Utah's Project ECHO for pediatrics. And we kicked off our new role in a collaboration with Utah State's Project SCOPE, which is around opioid exposure in children and infants. And so we've actually had several sessions now because they're going fast and furious. And I feel terrible for not having gotten that link out to you. So watch today, shortly after this meeting, I will be sending out the link for registering for those sessions if you're interested. And so there are really, really great presentations on a variety of things having to do with opioid exposure. And they're really targeted for this kind of an audience. And they have been recorded. So if you're interested in going back and looking at those, you certainly can as well. So I apologize again. I wanted to get a little more information out on that in this meeting. And again, I'll send an email right after this meeting with something actionable. So here are a number of the topics that are being included in 10 sessions. And you can see those dates over on the right. Again, we'll send all of this out. And so that's the link that I'll be emailing. But the last thing I wanted to mention on this is that each one of these sessions wants to take a look at a case. at least one case. And so if you have any cases of suspected NOWs or NAS, they would be very interested in having you present. And it's a pretty relaxed atmosphere. It's, I've been attending these sessions and everybody's great. It's very much like what we're doing here now, just with the case prepared a little bit in advance. So if you have something like that, they would be very, very interested in getting that information and asking you to talk about that a little bit. So, let me know and we can work through that if you're interested and able. All right. I wanted to make sure you guys are aware that on October 13th, it is the 3rd annual Teen to Adult Healthcare Transition Summit. And I think many of you will have received an email about this, but again, after this meeting, I'm going to be sending a separate email about this so that you can be sure and get registered. There is no fee, but we do need you to register in advance. If you've attended this before, they are excellent. And this is part of an ongoing statewide project between Intermountain, University of Utah, and a lot of other great groups, including Eric's group at the Department of Health, in really trying to provide resources and an approach that everyone can get on board with that will help, overall with what we know as a really big issue as children and youth with special health care needs age and need to have adult health care and other resources in place for them. So I hope that you'll be able to consider attending. It is a hybrid conference, so you could attend either in person if that's something that your schedule permits and you'd like to do that, or you can attend virtually. So we hope that you will really consider that on October 13th. And again, I will be sending something out shortly after this meeting. And we would encourage you to go ahead and get registered for that.
And Mindy, there's going to be a panel, I believe first thing in the morning that day. And there will be 3 of us there from the Utah Parents Center, myself, Luann Jones, and Amy Hurst. And so, and also our friend Eric will be joining us as well. Am I right, Eric?
Indeed, you are. Just getting ready to hop on the bandwagon there and say, we're also doing a panel from Integrated Services Program, which will be moderated by our very good friend, Mindy Tuller. So we're going to be talking about rural experiences, how to connect with resources in the community, some kind of tricky cases and just some success stories of our care coordinators being innovative and helping youth connect with local and or statewide services.
Yeah, I think this will be, just a really great opportunity to see what's happening and learn more, because things are happening and we're really pleased about that. You can see that the target audience, the second role listed there are care coordinators, but certainly anyone else on your team would also be invited, and we think they would benefit from this. So we hope that not only will you consider joining, but you'll pass this information along as well.
Well, just one last little thing, you'll notice it's the 3rd annual. The very first year, it was just kind of to let everybody know what transition is, meeting of the minds. The second year, a lot of ways to offer care coordination and transition in practices in social service areas. And then this year, it's some real hands-on lived experience. These are methods, means, ways to connect families with transition age services. So it's every year kind of a moving target, an iterative process, but each year builds on the last. So if this is your first year, please start now and just know this will probably be an ongoing event each year, generally held around the middle of October.
That's right. Thank you, Eric and Tina. Appreciate that. Okay, quickly, we always remind you about the Spark Autism Study, and just know that if you have any questions about that, we can answer those for you. And if you want any materials to, for instance, post in your practice or hand out, we can help make sure that you get those as well, whether they're digital or physical. All right, I'm just noting the time, so I'm going a little quickly here. We've had some updates and some new content we wanted to make you aware of. Looks like I forgot a parenthesis on there, apologies. So we do have several new pages, including one on NOWs. And we also have one on specific learning disabilities, somatic symptom disorder, and functional neurologic disorders. And we've had updates to several diagnosis modules, including cerebral palsy, spinal muscular atrophy, sickle cell, and tuberous sclerosis complex. I just want to make you aware of that available information on the medical home portal. All right.
Mindy, I wanted to mention too, we will be having a video that you can show families probably by next month. We've got the script written and we're almost ready to start creating the video to teach families how to use the CARE notebook.
Right. Yes, and that CARE notebook will have also been completely updated at that point. So we should totally showcase that, Tina, for sure. Thank you. Okay, Athena is taking the reins. Thank you, Athena. Athena's going to talk just really quickly about kind of a highlight with the medical home portal having to do with our topic today.
Yeah, so I wanted to highlight a few resources specific to COVID on our website. And the first is that you can see at the top, we have this information banner about COVID, which is going to take you to a page with some higher level links for like national data and some state specific data as well. I'll just briefly click on it. We're in the process of updating it, so don't be alarmed if this looks different the next time you click on it, but you can see here there's some good information for Utah and national data. And then over in our services directory, we also wanted to highlight some of the categories that you might want to look at specifically related to education. So I'm going to just scroll down to our topics for education. Here's our education in schools, and you can see we have a whole list of different subcategories that live there. Ones that might particularly be of interest are the special education schools, student disability services, and also school districts. So those are some that you may want to look at more in-depthly to find specific service providers in your area after today's speaker.
Thanks, Athena. So I don't know if I just take that back. Back to sharing. All right, great, okay. All right, so this is brainstorming time. And if you guys have anything you'd like to talk about, this is your time. So I'm going to be quiet and let anyone who would like to either post in the chat or just go ahead and unmute.
Sorry, you would always think it's my first Zoom or GoToMeeting or whatever, because I can never find the mute or video button. But anyway, I just wanted to put out a plug, like I've done the last couple months, to let folks know and remind everyone that the Integrated Services Program does have Chromebooks and hotspots that are available to families of children with special health care needs around the state for social service visits, medical visits, whatever. We loan those out for whatever the needed period of time is to families, and those technology items are located at the San Juan Health Department in Blanding. We have them also at Southeast in Price, and Southeast covers Price and Moab, also at Central Utah Health Department in Richfield, and in Vernal for Tri-County Health Department. And then in Salt Lake, we have some at the Utah Parent Center. And in Ogden, they are with our Integrated Services Program with Tony Estrada. So those are available for folks to use, and might be easier sometimes than trying to do an evaluation on a cell phone. So if people could benefit, please feel free to connect them with us. I will go ahead and put my contact information in the chat, and then Mindy and her team can include it with the minutes.
Thank you, Eric. We will do it.
This is Tina. I don't have any specific cases, but I just wanted to put a shout out to everybody. We, of course, everybody knows this, you know, but the Parent Center is getting unimaginable amounts of calls about respite, help, all of that. And it's nothing new. It's just more. It's more, and it's harder, and people are going to lose their jobs if they don't, you know, there's just so much going on right now with families, and it's our biggest call. So if anybody, I think we could maybe start some kind of a chat through email. If anybody has any new resources, ideas, we could just maybe throw them into that and say, hey, I found one. I know they're few and far between even to find right now of any resources for respite, or ideas for respite. And then also I really encourage all of you right now, you know, families that are in need, that are on the wait list, that are needing respite and help, or anything that has to do with the DSPD services, to encourage families to contact their legislative representative and senator. And it takes 5 minutes. Just let them know. You know, I have a lot of moms that'll say, oh, I just don't have time for that. And if you kind of ease them into the idea that it takes 5 minutes on the phone, or you could, there's very easy ways to just email them off your phone and just let them know you're struggling. And we've got to get the voices out there heard. There are movements happening right now to help hopefully change some of this, but we've got to get more voices heard. It's really important. People can go to the Utah legislative website and find their representative by just putting their zip code in, and start there. And it's pretty simple, pretty easy. And it doesn't have to be a long speech. All it has to be is, I am a family of a child with special health care needs, and we are struggling. We are on the wait list, or whatever. That's all they need to say. And I am your constituent. Please help.
Thank you so much for bringing that up, Tina. And if you want to shoot me that phraseology, I will send that out in the minutes so that somebody could just even copy and paste it and read it off, or you know, paste it into their email as they send it off.
This is Gina. I'll add one more resource along those lines of what Tina just talked about. Is we do have a legislative coalition for people with disabilities in Utah, which I am a part of, and we have monthly meetings that are starting now throughout the session and such, that brings up these things. And we're a volunteer organization, but help families with those steps of contacting their local representatives, as well as our representatives in Congress, because sometimes they go hand in hand on funding and changes. So I'll put that information in the chat as well.
Thank you. Great. Okay, anyone else? This is your time. I don't want to cut it short. Is anybody doing anything with quality improvement? that they'd like to share.
Hey, Mindy, can I it's Heidi with UPIC. Can I just put a little plug in that we're starting the upcoming asthma collaborative? And we have 3 clinics already signed up. And so we have room for a couple of more. If any of your clinics would like to join, we are offering MOC Part 4. Just shoot me an email and we'll get y'all signed up.
Great. Yes, Heidi, I appreciate that plug, and we'll make sure that your contact information goes out as well. But if somebody needs to get in touch with Heidi before then, just let me know.
Thanks, Mindy.
All right, and we haven't been focusing on it quite as much lately, but boy, I think we're going to hear about it here in the next few minutes. And I just want you to know that with regard to COVID, you guys know that I kind of have been changing the size of this little stamp thing here. It was big and then it got a little smaller. I think I'm going to make it big again, unfortunately. But we definitely want to know how your practice is dealing with COVID. So again, this is your time. And if you want to bring anything up that's relevant, as we're hearing from Judy and having that question and answer and comment time, we really want to know what's going on and how you're dealing with it. And if there's anything that you can share that would be useful to somebody else or vice versa. So. All right, well, 9:05. Let's go ahead and move into our main presentation. And we are so pleased to have Judy Jaworski join us today. She is the lead nurse with the Salt Lake City School District. And so you can imagine that she's probably a little busy right now. So we're really, really grateful that she has given up her morning to be here with us. I've known Judy in one or the other kind of capacities for a while. And I know that many others who are here on the call have benefited from her wealth of knowledge and her huge heart over the years. And so, Judy, we're just so pleased you're here, and we can make you the presenter because I believe you have some slides to show.
Thank you. Again, thank you for having me. I'm so happy to come, and I'm so happy to be asked to come and present to you guys today. So what I did is everyone sent me, or Mindy sent, and I think Eric, someone else sent me a couple of questions that they, I asked, what would you like me to cover? So they sent me some ideas to start to cover. So I put some slides together that will hopefully cover those questions. And then I expect we'll have quite a bit of time left just for question and answers. And then I can kind of answer any questions that you may have. All right, so give me a minute because I am going to share my screen. And I think I just need to take a look at this really quick. I'm going to share that one. Can you see my screen? Is that?
Not yet. Let's see, Michelle, were you able to give Judy permission for that?
Yeah, she's a co-host. So
can you see that now? Can you see that screen? Can you see my slide?
Not yet.
Not yet.
Okay, let me just see what I need to do. Let's see, share my screen. And
yeah, with Zoom, it gets a little tricky because it wants to either give you a specific screen to share or your entire computer.
Yeah, I would kind of like to.
Yes.
Can you see that?
Yes, we can.
What I want to do though is just give me a second because I want to see my presenter's mode. There. Okay. You're not seeing my presenter screen though, correct? You're seeing the real screen?
Real screen.
If we do this long enough before I retire, I might get really good at this. Okay. All right. So one of the questions is what's different about this school year and compared to last year and maybe other school years? Well, and we all know there are some differences. In regards or in comparison to last year, there are more students attending in person. So that's a good thing. In districts all around our county, as well as in Salt Lake City School District. In Salt Lake, and I talked to a couple of nurses, lead nurses around the area, and there are some, some distance learning opportunities available for both gen ed and special ed. Can't really speak to the specifics of those, but I can speak a little bit in more detail about what's going on in Salt Lake City. So we have our K through 6, we have Salt Lake Virtual Learning Academy for those who can participate in that sort of learning experience. The high schools and middle schools are also partnering with the Connections Academy. And for students with more significant disabilities, there's always the option to do online school with their current teacher that they're having right now. So that is still an option in our district. All right, so thinking about, different ways COVID is impacting this school year and what families should be paying attention to. We all know that there's been a significant increase in the number of school-age children that have been infected with COVID. Cases among school-age children at the beginning of the year were 4.8 times higher than they were the previous school year. So you can see up here that our cases are just a lot higher. So we came in, starting quite a bit higher. This is because, we have limited safety protocols in place, and the Delta variant is more transmissible. So although symptoms of COVID may be oftentimes may be mild, and hospitalizations haven't been real common for this age group, we can see by the following graph, or the graph below, that is increasing. So we're starting to see kids get sicker and hospitalizations go up. So this is something definitely that I advise parents to pay attention to. So mitigation efforts, of course, keep your students home if they're not feeling well. Keep them home and get them tested. In the Salt Lake School District, we have, whenever a student has symptoms, and pretty much that's any symptoms of any illness at all, our protocols are that parents have 3 options. They can keep them out for 10 days and send them back when symptoms have resolved after the 10th day. Or they can take them and get them tested, or they can take them to their pediatrician or their physician and get another diagnosis. So we are in the Salt Lake School District, we are very proactive about illness, trying to mitigate the spread of COVID with kids who have symptoms. That does vary throughout school districts. That is a guideline that different school districts, they're different. They vary in different school districts. So just a point, our COVID transmission in our county continues to be high, and of eligible students who are eligible, to be vaccinated, we have about 50% that are fully vaccinated at this time. Okay, so what can families expect from their child's school in regards to COVID? Well, mitigation efforts. I feel like all schools across the state are using layered mitigation efforts to keep cases low so that students can continue to attend, be healthy and attend, and we don't want to have any disruptions in learning like we did last year. So what we're doing is we encourage everyone who's eligible to get vaccinated. It's proven to protect individuals from becoming seriously ill, and so we do encourage that. There is a mask mandate in place for Salt Lake City schools. So we encourage everyone who is eligible to wear a mask in school to wear masks, regardless if they're fully vaccinated or not. So we're trying to protect, everyone, those who cannot wear masks, and by asking all of those who can wear masks to please wear masks to school. There's clear scientific evidence that wearing a face mask really does reduce the spread of COVID. Social distancing, we're all really trying hard to keep our social distance. However, as you all know, schools, we have so much space in schools, and all of our students, the majority of our students are attending school now. So space can be an issue. So whenever possible, we are 6 foot distancing, but again, that can be difficult. Frequent hand hygiene, we're certainly promoting that. We are disinfecting and cleaning our classrooms regularly, and encouraging teachers to do the same in between classes and in between when they use any kind of shared anything shared. And again, recommending COVID testing and offering resources whenever it's recommended. So what should I expect to do if my student's exposed at school? Individuals who are exposed to someone at school who tests positive for COVID may continue to attend without any disruption in what they're doing if one of the following applies. The exposed person who tested positive and both people, everyone involved in the exposure was wearing masks. So if it's a masked exposure in the classroom, then no one will be asked to do anything different. If the exposed person was wearing an N95 or a KN95 mask, then there will be no interruption in, what they're doing. They can continue to attend school like they were previously doing. If the student who's exposed is fully vaccinated, it's been 2 weeks since that final vaccine, or if the student who's exposed recently tested positive for COVID within the last 90 days. Anyone who does not meet any of the criteria above will receive a quarantine letter and must follow the guidelines for quarantine and exposure. So what we do is we'll grab a class list of people who were in close contact with the student, and we will send out quarantine letters from the state that will give these two options. So we no longer require with school exposures that students miss school to quarantine. Students can continue to attend school and wear a mask during that quarantine period. There are two options. They can wear a mask for 10 days. And after that 10th day, if they've not had symptoms, they can take it off. And if they were not wearing masks prior, they don't need to wear it after that. Or they can continue to attend school and test on the 7th day. If they're negative and they're not a mask wearer, then they can go ahead and take the mask off at that point. Again, in Salt Lake District, the majority of our students are wearing masks. There is a mask mandate. We are strongly encouraging faculty, staff, and any student who can wear a mask to wear masks, in attempts to keep everyone safe, to keep our cases in our schools low. All of that being said, if your student is in a classroom where there has been a positive case, even if masks were worn and no quarantine letter is needed, we will let parents know that there has been an exposure, there has been a case in their student's classroom, and this letter will ask them to just watch for symptoms for 2 weeks. So we do notify parents. Of course, any of these individuals following any sort of, either one, whether they were quarantining or not asked to quarantine, again, anyone who develops symptoms, we want them to go ahead and stay home and quarantine. And all of this being said, I think lunchtime is one of our most interesting times of day, because we don't always have 3 feet in our schools to socially distance, and masks are not worn at those times. So just pointing out, lunchtime is a time in schools around our state, I'm sure, where masks are universally not worn. It's awfully hard to eat with a mask on. So what about home exposures? They're different. They're different than school exposures. If there is a home or a community exposure, there is no option to quarantine at school. There will be a quarantine where the student will need to miss school. So let's see, there's the 7-day quarantine option. Now, this is for people who don't live with the person they were exposed to. So what they can do is after 7 days after that exposure, they can go and have a COVID test. And if it's negative, they can return to school. We just ask them to continue to monitor for symptoms for an additional 7 days. And if symptoms occur, to go ahead and stay home and be tested again. If the student lives in the same household with the person that has tested positive, that's where it gets a little tricky. Because what has to happen is the person who is been exposed needs to be 10 days away from the person who is tested positive. So unless they can separate in the household, which means not using the same living area, including bathrooms and kitchens, then they will need to start a quarantine on the last day of that family member's isolation. So students, if they can't separate, can miss up to 21 days of school or a home quarantine. And that's where it gets a little bit tricky. We have a lot of questions about home quarantines. And that's where I think that knowing what your learning opportunities or options are at school is really important. So parents, if this happens in their families, can get the learning, participate in another learning option during those days off. So another question was, how can I best advocate for my student? Good questions. And I just kind of brainstormed here because there's a lot more other ways to advocate for your student for sure. But just coming to mind right away was stay informed. Your district should have, Salt Lake District has a dashboard. It's right on their webpage. You can go and you can look and see how many cases of COVID we have in our district and what schools they're at. I'm sure other districts, I'm not sure. I do know some of the districts around Salt Lake County. Some of them are using their district dashboards, some of them are not. They're just relying on the county dashboard. You can go ahead and pull up the county dashboard, and that's the link for it right down here. Just to mention this, just a disclaimer, they don't always match. Reason is because they don't always upload information at the same time, and they don't always dump information at the same time. And so, so they don't always match up exactly. So just keeping that in mind when you look at the dashboards. In Salt Lake District, our dashboard is more real time than the county dashboard. Be familiar with your district guidelines. I mean, I gave you an overview of what the guidelines are for the state, and kind of with a little bit of a tilt towards what we're doing in Salt Lake. Do be familiar what your districts are doing, what their guidelines are for stay at home, for symptoms, all of those sorts of things, so that you can be aware and beware of those. Know the learning options available in your district, so that if you are put in a situation with your student where your student maybe can't attend in person for some reason, that you can quickly get into another learning option at a distance or an online option. And know your student's nurse, your school nurse, stay in touch with them. I mean, school nurses are very, we have our hands in a lot of different areas of your student's life. If your student is affected by COVID and yet doesn't have a health care plan, we can probably help with some advice, or we're happy to try and help and do, be useful, be helpful any way we can. So know who your student's school nurse is. I think that she can offer you all kinds of information and maybe options. So that's what I have as far as my my slides. I'm so happy to answer questions. I didn't really touch on healthcare plans. That was a question. Hey, how is it going to change how we manage healthcare plans? And the reason I didn't put it in there is because it's really not going to change how we manage healthcare plans. I mean, there will be students that don't attend, maybe because we've determined, the parent, the physician, and maybe the school nurse has determined that maybe it wouldn't be the best option at this time for in-person attendance. But we are writing in all kinds, we are adding to healthcare plans anything that we need to make, school attendance possible, but not a lot of COVID mitigation. We don't write that into the healthcare plans because we are mitigating COVID all over the school at all times for all students. So that's what I have to kind of throw in there about healthcare plans. So any questions you may have, I have not been looking at the chat. If someone wants to kind of help me look at the chat, or if we've got anything in the chat, or if you want to pipe up and just ask questions, I think that would be great.
Yeah, there's nothing in the chat yet, but please feel free to use that, guys. And
hey, I just unmuted. Am I okay to ask you a question, Judy?
Sure.
I know you're specifically with Salt Lake School District, but what is your sense as far as statewide school districts? Are a lot of them all kind of on the same wavelength, or does it depend on how, I hate to use the term, but what the political environment is in the district? Some places more liberal versus conservative. Are you finding that there's great variety and variation around the state, or most school districts kind of following the same kind of a plan?
I think most districts are following the same sort of plan. We've been asked by the Salt Lake County Health Department to work closely with our reps that they provided us. Every district has a rep, and we work with our health department's representatives, and they really are helpful. And that instruction just came out again, telling us, kind of defining what our roles are. The school role is to contact trace within the school as we identify cases with the health department, and on our own, we are to contact trace within the school and give quarantine and isolation information to schools and to parents as far as the school goes. Contact tracing outside of the school with other contacts belongs to the health department. So I know that that is all very much the same with, among school districts. How schools handle their guidelines, their symptoms, and that sort of their guidelines as far as when students can return with quarantine can vary, or with just symptoms. And wait a minute, let me back up. Quarantine, I made a mistake, I misspoke. Quarantine is pretty much the same. I think where you see the differences is if students go home with symptoms, you see some districts handling the options differently, depending on the school district. I think there are some differences. They're minor, but it's good to be aware of what they are in your district. Not sure why they're different, not sure if it's political or what's going on, but
well, I appreciate that. My ex-wife is an elementary school principal at a school in Jordan District, and I know when they had their back to school night, tried not to make the focus of it be COVID, and basically told parents, if you want to mask your kids, that's fine. If you don't want to send them with masks, that's fine too. So kind of a little bit of a laissez-faire kind of an attitude there. Are there still the requirements? Like last year, they would shut a school down if X% of kids tested positive or whatever. Are they still doing that this year as well?
Yes. And let me back up with the masks quickly. We, because we do have a mask mandate from Mayor Mendenhall, we do strongly advise masks. And as I walk through my high schools and my larger schools, and of course the smaller schools follow suit as well, most kids in the halls are masked. As I walk into my special education classrooms, my self-contained classrooms, again, a high percentage of those students are masked. So we are highly encouraging masks, and I think that is very important. I think. And what was the second part? What was the second part of your question? I'm sorry.
So the second part was just that last year, when it would like the school population would reach a certain threshold, percentage of kids tested positive, then it was all like, everyone was online.
We are all in line on that. That's a state guideline that we have to follow. So if you are in a school with 1,500 or less students, if you have 30 students testing positive in your school, you will be asked to test to stay. And what that means is that everyone the health department will come out and test every student in our school. And students who test positive will have to go out on isolation. Students who refuse to test will have to stay out of school for 10 days. So that's what that looks. Now in schools like high schools that are 1,500 or more, it's 2% of the population. Then we would do that same test to stay. Do all of that testing to stay. So that is the same across the state. That is standard. And now that we in our elementary schools, because in our elementary schools you can get more than 2% of your population positive and not hit that 30, that number 30, having 30 students. We are working, kind of taking the data a little bit more granular and looking into who are the homeroom teachers and kind of trying to figure out if there's something that we need to do differently in the classrooms. And if we found that we had certain teachers that had more cases in their classroom, then we would step in and the health department would help us do something a little different. So we are looking more granular at some of this data as well.
Judy, so the test to stay, the testing would be done within the school?
Yes, we do it at school. We would get permission from all parents to test. Now, and there is an option, I know there are parents that are saying, well, my student can't test, or my student, I just don't feel like comfortable testing him. there is an option if you can take your students somewhere else and have them tested, maybe at the doctor or somewhere where they would maybe feel more comfortable. It just has to be done on or after the testing day at school, right? Can't be done before that. And we do have other sorts of options for some of our students that we just can't test. And I think that's a discussion. If you have a student that just cannot be tested, then there are discussions you can have with your administrators. And as well as, and that may include one of those options to go to a distance learning, change to distance learning temporarily, or just other options are available. Just keeping that in mind, because we realize not all students are capable of wearing masks or being tested.
Right.
What would a student that can't be tested look like? I mean, what would a reason be why you couldn't test a student?
Well, I think that parents would probably bring that to our attention and just say, there's just no way my student is going to tolerate. These are all rapid antigen tests. So it's not it's not the swab up the nose or the brush up the nose. It's just the rapid antigen test. So it's just a quick swirl inside of the nostril. So it really isn't invasive, but if parents say, my student would not tolerate that, it would just really ruin my student's day, or he just wouldn't tolerate it, it would be too invasive. That might be a reason, Tina. We don't do the spit tests. Of course, spit tests, they're the PCR tests. That sometimes is difficult with a lot of students. So I think every kind of, I think it would just depend on the student and what the parent felt, the student was capable of tolerating. Does that make sense?
Yeah, thanks.
Mm-hmm.
There is something in the chat.
Oh, okay. For kids coming in for clearance to return to school, is a rapid test okay, or is a PCR preferred? We have parents coming in saying rapid tests are okay per school request. Okay, so thank you. That's a great question. So if we ever, so let's just talk about some of the times you would be required to bring in test results. If your student went home or presented with symptoms either at home or at school, and our symptoms are pretty, in the Salt Lake District, our symptoms it's a variety of symptoms, pretty much every symptom. So if your student was sick with one of these symptoms, we would ask you to choose an option. One of those options would be, if your student has not been exposed, to go ahead and get a COVID test. And then you would need to show us the negative test. We don't require that you bring it in and it's all formal, but you do need to show in Salt Lake District the COVID tech or the teacher or the administrator, right? And they'll share it with us. As far as them being PCR or rapid antigen tests, we take either. PCR, that being said, PCR tests are more dependable. We've seen them be a lot more dependable than the antigen tests, especially if there are no symptoms. When a student presents with symptoms, the antigen tests seem to be more accurate. We do, however, take both. So just keeping in mind, a PCR test has proven to be more accurate than an antigen test, especially when there are no symptoms. Yes, and a home test. Let me talk about home tests, because we've had a lot of people bring in, go purchase home tests and do the home tests, and asking if we would accept the results of those home tests. And the answer is, at this point, and it could change because everything changes with COVID, but the health department is allowing us to accept these home tests as long as they're the type of home tests that can be registered online with the health department. So these tests, I've not really seen one, but apparently these tests come with instructions about how to get on and register the results of the test. At that point, then you could print off or take a picture of or something, a copy of your completed form, and then you could present that to the school, and then that would suffice as your negative test. I have noticed, though, and this is not supported by any evidence at all, but I have noticed that we've done a lot of repeating of home tests with other sorts of tests. And we've also had conflicting results. So take that with a grain of salt with home tests. I don't know if it's a home test or if it's the method which they're used, right? I mean, there's always the best practice to use a test to get the accurate results. So I'm not sure what what is going on, but we are seeing tests being repeated after the home test, and the results don't necessarily match. And I do, and while we're talking, can I just say one more thing about testing? If you do have a home situation where maybe a parent has tested positive it's a situation where the student cannot separate from that individual who has tested positive, there's no way to test out of this sort of quarantine. The student can't keep testing and come to school. You still have to have that full 10 days away from a contagious person, right? So that would be starting the quarantine on the end date of the parent's isolation date. But during that time, the student can be tested. Oftentimes, if the student tests positive, the isolation time is shorter than that full quarantine time would be. That is a discussion that you can certainly have with your school nurse. You can have the school administrator if your schools have COVID techs, but you can have that discussion with someone at school that's managing the COVID, and they can direct you to someone who can help you maybe figure a way to keep that time out of school to a minimum. I hope that makes sense.
Yeah, that does make sense. And that 21 days out of school sounded terrible.
It's a long time. Whenever I talk to a parent on the phone, and that is the only thing I can see, it makes me feel very bad. I just feel terrible because we're trying so hard to keep our kids in school, because I did, with our special education kids, we did have online learning, and we had a lot of our kids, most of our kids participating in school, either online or in person, at different times during last year. So their learning was disrupted, but I'm told it was not disrupted like general education learning was disrupted. And it was disrupted 1.5 years. And so, they're behind. They can be behind as far as 1.5 years of in class learning. So to tell kids that they have to stay out, for 21 days is really unfortunate. So again, so important for you guys to know those learning options available in your school. And I would ask ahead of time. So if my student had to go out, how fast am I going to be able to hop on? Is this something I can pick up and hop on tomorrow? Because I don't want my kids to miss any school. So in advance, talking to your teachers, figuring out, hey, how quick could I switch if I needed to? And if it's a long time, maybe that's something that schools need to start to think about and work on, making it a shorter number of days.
So I'm just wondering, and Judy, you may not have the answer to this question, but I wonder if perhaps someone else on the call does. Is there a place maybe on the Utah State Board of Education site that talks about, kind of lays out one spot where all of the alternative learning options are? Because this group, I'm sure they would love to be able to provide to the families they're serving a link or some information. But because, we're several steps removed from the school system specifically, I would just love to know a central location that we could point to so that we could help those parents more quickly. And I'm not sure that Judy, you would be the one to know that, but I think we'll look into that for sure.
I think that's a great idea, because I feel like it can take a minute to figure things out, and that minute can turn into a couple of days. So if
precisely, yeah.
Right. So I think that's a great question to ask. Yeah.
Okay, so maybe that's something that we can do a little research on and include in the notes when we send out the notes from this meeting. And really highlight for this group. And Laurel says in the chat, yes, Laurel, there is the page on the coronavirus.utah.gov site that shows all of the case counts by individual schools. So that's kind of one of those dashboards. Yeah, and it's striking. I admit that after school started, I sort of didn't go there for a minute. And then when I did, I was like, oh, this is real again.
Yeah. Well, if they could have a site very similar to that, just with learning options.
Wouldn't that be nice?
Yeah, that could be a great page to that site. Yeah.
Okay.
Okay, this is
go ahead.
I got a couple things. So I wanted to take this, to just one bit of a higher level and explain how that looks and works. So we, of course, Adam, my son, who is now 21, last year of special education in the Salt Lake district, he is a little more fragile, and he has a tracheostomy, and he has chronic lung disease from prematurity. And so we watch closely, and he has been isolated since COVID started, until, we had a few good months in the summer where he got to go a lot of places and do things. And Judy worked tirelessly to figure out how to, make things work for Adam. And so we did have things set up for him to go to school this year. And then about 2 weeks before school started, we started getting nervous. And I think we made the right choice to keep him home this year. With that being said, when I went to register him, he had the choice of online school or in person. And I had registered him in person. But the online school option this year isn't necessarily what we scrambled to do last year for COVID. And so his teacher needed to, request, to the special education supervisor and some others that Adam have access to the classroom through being on an iPad. And so this year she's pumped it up. This teacher, first of all, you have to have an amazing teacher to do this, but Adam is literally a face on an iPad in East High School. He walks through the hallways with people, and we've got other students saying, "Hey, Adam." We've got the principal. He did a fire drill, and he was out on the front lawn, and the principal counted him when she came around to count all the students. And he's happy, as happy as he can be in our situation. He is so excited to walk to lunch with the other kids. He knows those hallways in the school, and they're very distinct red and white, bright hallways. He knows those hallways. He knows how to get back to his classroom. And so he's engaged. He's fully engaged in this type of learning right now, which of course, we wish he could be at school. I mean, that is the one wish that we have for at least some part of this year, hopefully. But if he can't, that's the option that we've been given, and it's working for him. It's not going to work for every student, but it's definitely working for him. The teacher she's even testing him. She's doing everything that she could possibly do. And so one of the things we did as a family is decided, is he going to go to school 5 days a week? And realistically, if I'm going to balance my sanity as a mom and trying to work and do the things I do, we're doing a partial week right now, and it's working. He's getting full days of school, and then I'm just getting my full days of work the other days. So it can be kind of, as long as they're, working on their goals and meeting their goals, and you're meeting with the teacher to talk about those goals, I think it can be done. It's, again, not what we want. We want him in school and to be there with all of his friends and all of that. But this is a really good way to do it. I am so surprised. I think Judy is probably too, that this young man is interacting with people on an iPad, but it's also something that we have learned that we have the ability to do. So, but yeah, Judy did go through all the proper channels when she thought about Adam. And the reason we have to think about Adam, it's not just because Adam could get sick. Absolutely, that's a big one. But what would it look like if he got sick? He's nonverbal. Think about taking him to the emergency room right now with COVID. How would that play out? It wouldn't be as easy as going to the emergency room without, if COVID wasn't a thing. And it's still not easy to go to the emergency room without him for anything. And so we have to think about, would he be able to tell us about his symptoms? Would we know what he's feeling? would we be able to be with him in the hospital? Would he have a bed space in the hospital? And so those are the other considerations with a person like Adam that you have to consider. It's not easy for anybody to go to the hospital right now with COVID, but with him, you just don't even want to try to go there if you don't have to. It's so those are the things we look at. And Judy looks far beyond just what happens at school. She looks at his, whole being and his whole life and how he would be affected. And so I appreciate you, Judy.
Oh yeah,
that's nice. I appreciate that. And Tina is right. And when you're looking at your students, look, and trying to determine, the best place for them, their best learning their best learning opportunity, or where they should learn. It's important to look at all of that. Yeah, yeah.
So what I was hearing from that, and Tina, thank you so much, is that, parents should very definitely reach out and work with their students, their child's teachers, their child's school nurse, and really understand, as Judy was talking about, what the alternatives are for their situation. We know that that's harder for some families than it is for others. And Tina is remarkable in, how she is able to approach all of this. And of course, part of that is because we have such amazing resources like Judy in the Salt Lake City School District. And I'm sure that there are amazing resources throughout all of the districts as well. So I think if we could just help families and help care coordinators and care managers to be able to connect those dots so that whatever family that you're working with, you can get them to the right starting point. And then hopefully, they're able to do a lot of it on their own from there. But you'll know what those resources are as well to help them if they need more help. So I see another chat. Thank you, Jennifer. Right. Okay. Wonder if we should pop that up on the screen. Maybe we'll take a quick look at that site. Let me share my screen. Okay, so this is the website that is from the state and has to do with, I'm sure, all of these recommendations that Judy has been telling us about. All right, the COVID report is updated weekly on Thursdays with regard to case counts. There's the test to stay information. There's testing. Okay, good. This is really helpful. Great. Thank you, Jennifer. This is good. We will make sure to include this in our meeting summary. So a question that I have for this group, I'll stop sharing now, is, what are you seeing and what are your thoughts on trying to help families through this time? It's been really interesting to me. So my kids are in the Salt Lake City School District, and I went to a football game the other night, and I was surrounded by people who were not wearing masks. Granted, it was outside and they weren't tightly packed, but there were lots of people who were sitting close together. There were lots of opportunities to be near one another when you were in line for concessions or the bathroom, or just going up and down the bleacher stairs. And oh, I wanted so badly to talk to those families about wearing masks. A lot of families brought little kids who clearly wouldn't have had the opportunity to be vaccinated. And I just, it's just tough, right? It's just tough. And this is a school district where masks are theoretically mandated. And so these are families who do know about all of this. They've heard about this time after time in the communications that come out. So I would very much like to ask this group, are there opportunities for you when you're seeing families to talk about masks and mask wearing in schools and mask wearing when you're not in schools? And tell us your thoughts and feelings, because guys, only 50.3% of eligible students are vaccinated in our state, according to those stats that Judy provided. What can we do? Because here we are again, September, and look at what we're facing. Anyone?
This is Gwen from Price, and I just think that there's probably not a lot we can do in a group setting, but maybe one-on-one. But we have so many people that are just resistant, and truly they believe that like it is fake. Like they believe that COVID is fake, and they like to blame, well, did they have underlying health issues when somebody gets sick? I don't know. It's very frustrating. And I don't know, but it's really hard. And maybe I think individually, speaking to people individually with us, very frustrating and scary.
Yeah, that's a good point. Jennifer has just posted in the chat. Jennifer, are you able to unmute and talk?
Yeah, we talk a lot about this from a physician perspective of trying to talk with patients and families to encourage vaccination and mask wearing. And, I think most of us are doing that with almost every family that we see in clinic. With that said, I feel like at this point, there are a lot of people who are not interested in hearing about numbers and science. They've heard that that's not moving them to change their stance. So the thought is that sharing stories, your personal experiences and worries, and trying to be a good listener for people who have different viewpoints may be more motivating than just saying, well, the science is sound and because people have already made up their minds that doesn't change it for them, most people. I will also say that, I just came off of another meeting with physicians where I heard that they've had multiple bomb threats at Primary Children's because people are being told to wear masks when they go. It's alarming. And another friend of mine whose colleague in emergency medicine was threatened with a gun for saying that a patient had COVID. So it's crazy. And I just, I'm trying to be really sensitive and understanding to people having different viewpoints, but it's so disheartening. And I think, trying to reach out to other people for support during this time and being aware that we're fighting against something that maybe, this might be about as good as it's going to get in terms of vaccine compliance and mask wearing and so forth.
Oh my gosh. Thank you for sharing that. I'm sorry. Thank you. Pat has mentioned something in the chat, and it's helpful. Pat, are you able to unmute and tell us about that? I can read it. Pat says, okay, I can read it. I have started to ask if their eligible child, so 12 and older, is up to date on their immunizations and the vaccine. The answers vary, but I do ask. So you're just helping to normalize that by grouping it with all of the other immunizations that are typical and important. Okay. Yeah. No, it's so tricky. And I, of course, this information is so helpful for all of us who are working with kids or have kids who don't have underlying situations or other special healthcare needs that are happening. But those are the ones that, of course, I am the most worried about. And Adam's situation is very helpful to illustrate that. Does anyone have a family that they're working with who is facing some of these same questions and concerns that Adam and Tina and their family are have had to make decisions on?
You know, I can't relate it back to like a family, but I'm going to say from a personal perspective, I had my first immunization in January. 3 weeks later, I had it in February. And in June, I got a case of Delta variant. I think I did really well with, you know, the time frame that I had it because I was immunized. And I preach the gospel of immunization to all my friends and people that I work with, and basically say, I think I had a better case because I was vaccinated. Lost my sense of taste and smell, which that was my indicator that something was going on. I thought I just had sniffles for a couple of days prior to that, and then I woke up on a Tuesday morning, couldn't smell or taste coffee, and that right there was the clincher. I was not febrile. I had slightly enlarged lymph nodes, tired like you can't believe. So I'm here to tell you it's a real thing. But you know, even when you provide personal anecdotes to other people, it doesn't always convince. So with that said, I just have a generic question. Are you finding in your practices that the families who do not wish to immunize their child or vaccinate their child for COVID are also the same ones who are anti-vaxxers on everything else anyway? Or is it a mixed bag? We believe in measles, mumps, rubella, polio, all that stuff, but we don't believe in this vaccine. So I just wonder generically if there's a kind of a consensus out there of, you know, what you're running into in those practices.
Eric, we're mostly seeing people who will vaccinate the majority of their vaccines, but may decline selectively, such as flu or HPV, who are more reluctant to move on this vaccine. They'll get the ones they are required to get.
Anyone else? Be really interesting to know what you're seeing.
You know, I will say, you know, at the first of the year, we had a lot of, well, you read it in the newspaper, a lot of sports events canceled because we didn't have enough players to play a game. We are starting to see that be a motivator in that age group to be vaccinated. So there are some motivators. We have had more kids get their first vaccine. So just that has motivated people to be vaccinated.
So I have a very, very, very close friend who doesn't want to get vaccinated. So of course she's not welcome to come to the house. We social distance on the porch once in a while. Her kids are grown, but so she said something one day about anti-vaxxers. And I said, Christy, you're an anti-vaxxer. And she said, well, no, I'm not. I got my kids vaccinated. And I said, yeah, well, your kids got the COVID shot because they're grown-ups, but what's wrong with you? And it's this answer. And the beauty of our friendship, we're ride or die, this girl and I. But we just never cared about opinions like this or politics or anything. It's just, we have a really pure friendship and it's great. But this has definitely, we've never argued more than this. And it's, yeah, she vaccinated her kids. She's not an anti-vaxxer. It's just that she doesn't know what's in this vaccine and the FDA or the, you know, it hasn't been approved. Well, it's now been approved. And what's your excuse now? So it goes on and on like that with some people that just don't want to put this vaccination into their bodies for some reason. And so I don't know how we're going to get past that. I think we need to educate their children.
Yes. Yes.
Seems like the kids are responding a lot better than adults these days. Just my opinion.
Well, thank you so much, everyone. I'm just looking at the time here. Pat says in the chat that she finds that it's mixed, and that a lot of what's happening with the COVID vaccine seems to be the misinformation that's surrounding it. Certainly, yeah. The last thing I'll throw in there is that if we are looking to the children as our future, the thing that I've seen in my kids is that they are a lot more willing to wear a mask if it's a cool mask. And I realize that not everybody has the ability to just go out and buy a cool mask. But you know, if there's a little bit of a fashion statement in there too, somehow, that seems to help motivate them to you know, how you look is so so important at some of these ages. So I'll just throw that out there as well. Eric is saying thank you so much to Judy for joining today. We agree. You're terrific, and the fact that you took time out of this incredibly busy part of your life is so huge for us. So Judy, thank you so much. I think we learned a lot today. As I'm wrapping up, I just want to remind you again about the transition for teen to adult healthcare on October 13th. Again, emails will be coming out here momentarily with regard to that. And it was really nice. Sorry, whoever suggested that we do some emailing in between. I think it had to do with Respite. Yes, Respite resources. Let's use our listserv and see if we can't generate some ideas that will help all of these parents contacting the Utah Parent Center. And our next meeting is on October 20th. So again, thank you, big thank you to Judy, and thank you to everyone for joining us today. It's not quite as hot, not quite as smoky. Enjoy your day, enjoy the rest of your week, and we'll be in touch, and we'll see you in October. Thanks, everyone. Bye. All right, Michelle, I think we can stop recording. Thank you.